Good morning, everyone, and welcome to the State of the Plate, our COVID-19 edition. I want to mention just a few household items or housekeeping items. Please go to mute for this portion of the program. We also encourage you to use your speaker view for the first half. And yes, this is being recorded. On behalf of our board and staff at Food Gatherers, I'm very grateful that you are joining us today. I'm keeping my mask on for a moment so we can remember and acknowledge all of those who we have lost to COVID, and to also acknowledge all of the frontline essential workers who are keeping our community fed and giving direct services, both including Food Gatherers staff, all of our public health colleagues, and all of our pantry programs throughout the county. Our work is due to their efforts throughout this pandemic. So thank you. So in mid-March of last year, when the pandemic hit, Food Gatherers' business model was turned upside down overnight. We lost most of our labor force, which is about 7,000 volunteers. We lost half of our food supply, and we witnessed the most significant and dramatic increase in food insecurity ever. This was happening throughout the country and throughout the world. I've been at Food Gatherers a long time, and the only touchstone I can recall that had any significance really to what we were facing was the Great Recession of 2009. Which overwhelmed us at Food Gatherers and overwhelmed our local network. And that saw an increase of about 134% in food insecurity over a much longer period of time than what we're now experiencing. But at that time, we embarked on a learning process and sort of an analysis of what was happening in our community. And I want to share some of the learnings that we had from the Great Recession. We recognized that we needed to create a more robust network of food security network partners in our county, high capacity pantries throughout the areas, both in the urban and in rural settings of our county, that were more accessible to people, that had the infrastructure to distribute more food, more healthy food, and were able to connect people more effectively to other resources. We also learned that many food insecure citizens in our community were eligible, but were not accessing federal nutrition programs such as SNAP. We also realized on Food Gatherers' end that we needed to add expertise to our work. We needed to approach this work with a public health lens, with a focus on nutrition and advocacy and public policy. And so we began to create the Community Food Program Department that is now led by Markell Miller, who will be presenting later in the session. And many of our staff there will be hosting your Zoom rooms later. But that has enabled us to really build our network capacity. We also learned that food insecurity was persistent, but often unrecognized by many key institutions in our community and elected leaders. And we also learned perhaps the most fundamental and simplest truth, that food is health. So for the last 15 years or so, we have worked in partnership with many of you here today to address these inadequacies and build upon our work in order to leverage and advocate local, state, and federal programs and anchor institutions like healthcare and education in the fight against hunger. I am thrilled and appreciative of the partners who are on this Zoom meeting today, and for all the work you have done for many years, and especially throughout this pandemic. I want to particularly shout out to our Human Service Agency nonprofit partners, to our healthcare partners, to educators in K through 12 who play a huge but often unsung role in food security. I want to acknowledge our college campus pantries, our elected officials, both local, state, and federal, our funders, and our statewide and national anti-hunger organizations, including Food Bank Council of Michigan, Kroger's, and Feeding America. We will be sharing some sobering news about food security in our community, and we have a lot of work to do ahead of us. So I invite you to learn and reflect today. I encourage you to use the chat box to share appreciations, comments, observations, pose questions. I invite you to think deeply, creatively, and critically about our community response to food insecurity. But most of all, I encourage you to envision and imagine a hunger-free community and help us navigate a path towards that reality. I am very excited to be able to introduce you to Phil Knight, who leads the Food Bank Council of Michigan and was appointed as the chairperson of the Food Security Council created by Governor Whitmer. Thank you, Phil, for being with us and for walking with us throughout these last crazy months.
Well, it's my pleasure, Eileen, and thank you for the opportunity to be back with you at the State of the Plate. I love the sound of that, and would really like to steal it for one of our own events, but I'll make sure and give you credit if I ever do. So thank you for having me back. It's an honor to represent the 7 Feeding America food banks that serve all of Michigan's 83 counties across our state. And as you described, what's happening at Food Gatherers is exactly what's been happening across the state. So let me see if I can kind of paint a picture for what the state, where we're at as a state as we drill down to the work of Food Gatherers. So prior to the pandemic coming to Michigan, our 7 food banks across the state averaged distributing about 2.6 million pounds of food every week. That's a lot of food. I think our record was 205 million pounds of food, and we're really thankful for the opportunity to be able to say that almost half of that food has been fresh. And so it shows quite the growth in our industry and the change that has brought about, and the emphasis on solving hunger with the food that people both want and need and as culturally appropriate as possible. So we looked at 2.6 million pounds, and from the middle of March right on through today, the food banks have averaged distributing 4.5 million pounds of food every week. There's been several weeks where we were well over 5 million pounds for a given week. And it's startling to think about how these food banks were able to, on the go, grow their infrastructure in order to move from 2.6 million to 4.5 million on average. So a startling growth, just almost straight up. And then for them to be able to grow themselves, their infrastructure, the fund development, everything that was needed. And the reason it grew to 4.5 million is because of the need that's been all across the state. Averaged out now to about 50% more need than what we've ever encountered before. So it's the most, the greatest number of people that we've ever seen to be dealing with food insecurity. And we broke those down into 4 groups so we could better understand it. Maybe this will give you a bit of a visual picture as well. So the first group we looked at was, well, of course, when schools were closed in mid-March. So the first group we wanted to make sure they had the right access to food were the innocents, and that were the students and their families. Next, we wanted to look at the group that we thought were the most vulnerable, and that would be the senior citizens. This was one of the things that we learned. I'll talk about that in just a moment. That one of the things that COVID has taught us is the gaps in our service and what we need to do in order to fill those gaps to make sure that no one's falling through. The third group that we looked at was the unexpected. And it's people that we saw in our long lines of cars at mobile food distributions who never had negotiated the emergency food network before, never thought that they would need to. But here they found themselves in need and having to make those choices about trade-offs that we know so many of our families that we serve do. And then lastly, the group that's emerged over the last few months is what we'd call the indefinite. And it's the people who will, that even though the economy begins to re-engage and recover, they will take certain industries longer, people who work in those industries longer to recover than it will for some of the rest. For example, one of the studies that we've completed is pretty much shows a K recovery of the economy, which is if you're a knowledge-based employee, you probably have pretty much continued to work. But if you're in a service industry, then you haven't been able to work by and large, and there'll be those that are indefinite, that are with us indefinitely as we move forward in the economic recovery. So how long is that gonna, what does indefinite mean? So one of the forecasts we use is the same one that's going to happen this morning with the legislature to forecast the revenue for the state, comes from the University of Michigan seminar on qualitative economics. And we use that study along with unemployment study to forecast food insecurity across the state. And we're looking at it heightened need all the way through June of 2022. So this is a picture that we're faced with, and we've had a lot of great partners that have come alongside of us, both in the private sector and then the state of Michigan, and then also, of course, at the federal level as well. So as we look at heightened need in June of 2022, how do we continue to distribute the amount of food to help meet the need? And that's going to be a challenge for us, as some of the USDA programs that give us food in order to distribute to the into the community is some of those programs are ending. And so we're hopeful they're going to be replaced. We're having those conversations. Obviously, Jacqueline from Senator Stabenow's office is going to be with us today, and she's leading the charge on many of those conversations. And then one of the things that I think emerged from the pandemic has been the creation of the Food Security Council from Governor Whitmer's office. And this was something that we had talked with the governor when she was a candidate about some time ago. And then, you know, it just, as administrations are going to work, and this came up with a poverty conversation. It came up with the racial disparities task force, the coronavirus task force on racial disparities, and then the Food Security Council. And I think one of the things I'd like to share immediately with you is that those three task force are having conversations and working together. We see a lot of overlap in how racial disparities in healthcare and in food insecurity, and certainly with the poverty task force, how we're approaching a lot of the work from different lenses, but we're going to end up in the same place, and we're working together on policy recommendations to do that. So it's been an honor to lead that group for sure. They're kind of like herding cats when their tails are on fire, but they're a great group and they're working hard. And our first report has dropped. It dropped on Monday. It's about COVID's impact on food insecurity across the state, with 16 recommendations to the administration on how we can better deal with COVID now and with any impending regional or statewide disaster in the future. You can find that at DHHS's website and also at the Food Bank Council of Michigan's website, which is fbcmich.org, and you can find it there. The last thing I'd like to share with you is a couple of things, how we've used phrases we've used to really understand this work. As Eileen talked about, what are some of the lessons we learned about our capacity and our capabilities? So what are some of the gaps we learned in where we weren't meeting the need? And so I want you to just think about this, that our mission is really to try to take hunger off the table. And if you think about that, that's a pretty visual statement, that the table is a place of blessing. The table is a place of abundance, but people don't have that are struggling under the toxic stress of being food insecure. So we want to take hunger off that table, replace it with access to healthy, nutritious food that they both want and need. And to do that, we'll need to continue to stand in the gap. Stand in the gap for people, our neighbors, our hungry neighbors, and understand this, that these folks that we serve, and we do our best to serve them well, these folks are not just somebody that might be needy. They are our friends, they are our neighbors, and they are worthy of our investment. That's why we want to continue to give our one handful of life to this work to create a food secure Michigan. Thank you.
Thank you, Phil. It was wonderful. Appreciate your perspective and inspiring words. And we're so appreciative of all the Food Bank Council of Michigan has done for the whole state and us in particular. It's been an amazing partnership to watch grow during this time. So thank you.
It's my pleasure. And I'd be amiss if I didn't say that, you know, anytime we have a new idea and an innovative idea that how this could help us go to the next level of food security, we think, let's try it out with food gatherers. But then when we get down there, you guys are already been doing it. So, you know, you're pace setters in Ann Arbor for not only for the Food Bank Council members, but really for the entire Feeding America nation. So thank you.
Thank you, Phil. Okay, everyone. Hello, I'm Markell with Food Gatherers. I'm going to pull up my screen, see if this works. I'm going to be doing a presentation. Give me a second here to make sure I can see everything. Okay. Bear with me. The stress of trying to do this all. Okay, can you see the actual full slide? Thumbs up. Okay, great. Welcome, welcome, Markell with Food Gatherers. As Eileen and Phil mentioned, I'm going to be talking about what our community's response to the increased need for food has been during the pandemic, and also what food insecurity is looking like because of the pandemic. I want to start with a quick acknowledgement and appreciation for the amazing community food programs team. A lot of you may be familiar with our team. Many of them are working behind the scenes. Our wonderful coordinators, Veronica, Aaron, and Rolanda, have been working tirelessly to make sure all of our community partners have what they need and feel empowered and supported to respond to the increased need in our community. Our colleagues Shira and Larry have been working behind the scenes as well to support our agencies and their capacity to serve. And then Scott, Amy, and Susie down at the community kitchen helping provide nutritious meals to everyone at the Delana Center throughout the pandemic. So a big note of appreciation from me for all of their work. So I'm going to start by talking about how our community has responded to the pandemic and the increased need by expanding access throughout the county. I want to first talk about how amazing it was that almost all of our pantries, all of our community partners were able to figure out a way to safely stay open. There was a lot of frantic planning. Some agencies had to make the difficult decision to suspend their operation. However, for the most part, all of our partners were able to stay open, which is really remarkable, especially when people were hearing in the news very distressing tales of pantries closing, people in other parts of the country having difficulty accessing emergency food and free groceries. We are really relieved that many of our partners were able to stay open. And so we really tried to get the word out rapidly through our network of partners, through social media, through the health department, the Office of Community Economic Development, elected officials, really trying to alleviate people's concerns and make sure people knew where they could go or where they could send a family member or neighbor if they needed food. So that was just a key takeaway from this pandemic, that our partner pantries were able to stay open. Of course, they had to pivot their operations and figure out a way to make sure that their staff and volunteers and clients could stay safe and comply with social distancing. A lot of our programs pre-bagged or pre-boxed stuff. Food gatherers built a lot of boxes of food for our agencies because many of them didn't have the space or capacity to do that safely. So we were able to get a lot of food out by keeping a lot of points of service open. A lot of our partner programs were also able to expand hours. They did this by adding days of the week that they were open or increasing the frequency. Some of our sites, which before the pandemic were only open once or twice a month, expanded to weekly. Food Gatherers was able to support this by hiring additional warehouse and driver staff, increasing the number of deliveries to our partner program sites, and they were able to expand their hours. And that expanding of hours really helped them serve more people and serve people more food, which was really appreciated during the pandemic. We also were really grateful that many of our community partners were able to expand or add delivery programs. As you can imagine, during a public health pandemic and a public health crisis, people who are at risk of severe illness, it's not safe for them to go to a pantry or go to a grocery store. And so we had to figure out how our partners could get food to people who were homebound, either for medical reasons or for risk-related reasons to COVID. And so we're really grateful, in particular for Jewish Family Services for expanding their program, Hope Clinic for launching a delivery program, and several other programs, including churches like the Word of Deliverance, who don't have official programs, but we know that we can call them when there's a family in crisis. And we're so appreciative that we have such a strong network of partners willing to be on call and help connect families to food in a moment of crisis. We also have added a couple of new partners. I want to point out Ypsilanti Evangelical Friends Church down in South Ypsilanti Township in an area where there aren't any other pantries, as well as Masjid Taqwa, which is a mosque at Gulfside and Washtenaw in Ann Arbor at the border of Ypsilanti. And we're really pleased to have them on board. They're in an area where there aren't any other pantries, and they're open on Sundays, which is a great resource for our community. Food Gatherers has been able to support our expanded access and expanded food resources. In calendar year 2020, we were able to procure and distribute 9 million pounds of food versus 7.2 million pounds of food in calendar year 2019. Last year, the calendar year, we distributed, that food was worth $14.5 million, and that includes $1 million of food that was purchased. The remaining food is food that's from the government or donated or rescued by us. We were also able to procure and quickly distribute masks and hand sanitizers to agencies so that their staff and volunteers could be safe and protected, and also pass that out to community members. We were able to provide cash grants with support from the community, including the United Way, to several community partners, particularly agencies that don't do traditional grant writing and weren't able to quickly access some of the other resources that required formal applications. We were able to get them cash grants to help cover operating costs so they could stay open. And we focused those grants to community partners in 48197 and 48198. We knew from early data that those communities were harder hit by the pandemic, and we wanted to make sure that those food distribution points were able to stay open and have the capacity and support they needed to do so. We also did some winter preparedness grants and training for our agencies. On top of COVID, September was coming, and we had to figure out a way for pantries to prepare for winter and stay open and handle, unexpected snowfall. So we did some training and additional mini cash grants to agencies so they could get tents and carts and heaters or whatever they needed to safely operate throughout the winter. I want to talk specifically about our partnership with community agencies as well as the schools, and how we were able to respond to the increased need that families, particularly families with kids, were facing throughout the pandemic. This is a picture of the crew down in Milan. People from the Aid in Milan, staff and volunteers, helped distribute food at a church in Milan in the summer. This was part of our summer food service program. For those who are familiar with it, the program normally provides meals that children eat on site. However, of course, during the pandemic, we don't want kids eating on site together. So we were able to pass out meals to go. We're very grateful for the Michigan Department of Education for providing a lot of support and training for us and pursuing waivers from the federal government that allowed us the flexibility to distribute meals safely. So families could drive up like they did in Milan and get a week's worth of food per child, 2 meals per day. So each kid got 14 meals that the family could take home. And this was an amazing resource, not just from a financial perspective, but the meals were ready to eat. So there's a great convenience and ease for those families picking up the meals. We were able to distribute a lot more meals because we added sites that weren't normally eligible, but we were able to distribute them meals there because of the pandemic and the increased flexibility we had. I also want to acknowledge our school district partners, Ann Arbor Public Schools and Ypsi Community Schools in particular. We worked very closely with them throughout summer meals, but our partnership grew dramatically back in March when the pandemic hit and the schools closed. So as you all know, schools have been and continue to provide meals to kids even during virtual or distance learning. We have worked with the schools to help those families by providing boxes of groceries, both non-perishables and sometimes perishable groceries, to the school. So that way, when families are picking up meals, they can also pick up groceries, and it makes it a lot easier for families to get the food that they need. So we're really grateful for our schools and the partnership we've had throughout the pandemic. I want to take this down to a personal level and just kind of have everyone visualize a lot of the people that are calling us food gatherers fields calls from the public. We get our phone number out there and encourage people to call us if they don't know where to go for help. And we have, of course, we saw a spike in calls back in March and April. They dipped down a little bit in the summer, but we're back up. Extremely high call volume, a lot of people who are needing food, who have never needed services before, as well as people who are in just an absolute dire situation. Their plans that they had in place to get food, to have someone else help them out, fall through, and they call us. They're down to their last meal, and they oftentimes don't have transportation, or they have a health condition and can't leave their home safely. Sometimes they have no power turned on, or they've been recently evicted or lost their home to a fire. So we get people calling us. They're calling for food, but our very caring and compassionate team quickly understands that their situation is so much more complicated. So we want to assure them that we can get them connected to food. We often, probably 99% of the time, get them connected to food that day. And we also connect them to an agency that can really help them in whatever that looks like. So for some people, that's utility assistance, some people that's rent assistance, some people that's clothing, furniture, etc. So we really look at the person and their whole situation and really try to connect them. And we couldn't have this sort of customized response without our partners. And I know I keep mentioning that, but we're just so grateful to have such a caring and robust network of community partners, and we couldn't do it without them. So I'm going to pivot and talk about food insecurity and some local data to help us understand how the pandemic has impacted food insecurity in our county. So when I say food insecurity, I'm talking about a household level economic and social condition of limited or uncertain access to enough food for an active, healthy life for all household members. And that's a pretty kind of technical way of saying you don't have enough money for the food you need. So I think we all understand the concept of food insecurity, and so that's the technical definition there. But how do we measure it? The U.S. Department of Agriculture does have an 18-question survey that can be used to help figure out that household's level of food security. But that's obviously not feasible to have every community member in Washtenaw County fill out a survey. So Feeding America, the national network of food banks, has a fantastic resource for us. Annually, they complete what they call Map the Meal Gap. That is available publicly. As Eileen mentioned, this is recorded and we'll send out resources after, but you can see this data at map.feedingamerica.org. And they have food insecurity data for the country, for the state, for the county, as well as congressional districts. And so how do they calculate it? Well, basically they look at food insecurity by analyzing closely linked indicators like poverty, unemployment, home ownership, disability prevalence at the state and local levels. And so they're able to calculate what they think food insecurity looks like in our county. Well, because of the pandemic, unemployment and poverty changed dramatically in 2020. So they refreshed our food insecurity rates for 2020 with those changes to unemployment and poverty. So I'm going to share those with you for Washtenaw County. So in 2020, because of the pandemic, so with those refreshed rates of unemployment and poverty, Feeding America is estimating that 14.6% of Washtenaw County is food insecure. That's compared to 10.7% in 2018. And so that's an increase of 36% of people experiencing food insecurity in our county. They also analyze the number of children they anticipate being food insecure, or they estimate being food insecure. And so in 2020, they estimate 15.3% of children are in a household experiencing food insecurity, and that's compared to 7.6% in 2018. So a doubling, or an increase of 100% of food insecurity for children. What does that look like in terms of numbers? At the county level, they estimate 55,000 people are food insecure, compared to 40,000 before the pandemic. And for children, they estimate 11,000 are food insecure, compared to 5,300 before the pandemic. So dramatic increases in both the percentage and also absolute numbers. Feeding America also provides us the opportunity to request an analysis of food insecurity at the zip code and census tract level. And this is really helpful for us to understand both the number of people experiencing food insecurity as well as the percentage of people experiencing food insecurity. This map here shows dots that represent the number of people experiencing food insecurity by zip code. I will say also at the bottom, it's linked here, and you'll get this in follow-up emails, but all of the zip code and census tract level data is mapped separately, and you can find that at tinyurl.com/foodgatherers, capital F, capital I, map, F and I standing for food insecurity. So this map here shows the number of people experiencing food insecurity by zip code. The zip code with the largest number of people is 48197. There's 12,000 people experiencing food insecurity in that zip code, 18% of that population in that zip code. The next largest is 48198. The dots here are placed based on the concentration of where people live in each zip code. So that's why those two, 48197 and 48198 zip codes are overlapping. When you go to this website, you can toggle around, zoom in, zoom out, click on stuff. So it's a lot easier to examine the data when you're in the interactive map. And that's why those dots overlap here over Ypsilanti. The other two zip codes with the largest number of food insecure people are 48104 and 48103, each with about 7,000 people experiencing food insecurity. And I want to point out that even though there are fewer people living in rural zip codes, the rural zip codes we estimate, experience much higher rates of increase. So all of these dots of zip codes where I put a red dot, and so these are our rural zip codes. Some of the zip codes straddle Washtenaw County and surrounding counties. That's why some of the dots are outside the Washtenaw County border, but do have some area within Washtenaw County. All of these dots here represent zip codes that saw a 50% or more increase in food insecurity. So these zip codes have fewer people experiencing food insecurity, but a much higher percentage increase in the number of people experiencing food insecurity. The next map I want to show you is a map that shows the number of people experiencing food insecurity by census tract. So this was another thing that Feeding America can do for us. They can break down the data by census tract, because a lot of the indicators that are closely linked with food insecurity are available at the census tract level. And so again, that's how they're analyzing it. They're not doing surveying community members. They're using data we have from the census tract level to estimate what the food insecurity rates are. So this map here shows the number of people, and as to be expected, it closely tracks where people live. There are fewer census tracts that take up a lot larger space in rural areas, and there are a lot more census tracts closer together in the higher population, higher density areas. So we see a lot of people obviously in the Ann Arbor Ypsilanti area where more people live. The next map, though, is going to show where the percentage of people are, and watch the dots in the Ypsilanti area in particular grow in size. This map shows the percentage of people experiencing food insecurity. So what portion of people in each census tract are experiencing food insecurity? And so there are census tracts that have a very high percentage of people experiencing food insecurity. And so the larger the dot in this map, the more people as a percentage of people in that zip code and that census tract experiencing food insecurity. So I'm going to show this map and in the next slide. It's the same data I'm shrinking the dots so it's a little easier to see, so there's not as much overlap. So this map, again, it's the same map as the last one. This is the percentage of people in each census tract who experiencing food insecurity. So the larger the dot, the higher percentage of people or portion of people in that census tract experiencing food insecurity. There are 100 census tracts in Washtenaw County. 31 of them have 20% or more people experiencing food insecurity. So 30 of our 100 census tracts have 1 in 5 or more people experiencing food insecurity in that community. So there's this big dot on, depending on how familiar you are with the map of Washtenaw County, there's a big dot there kind of on the bottom right corner. That is the Women's Correctional Facility, the Huron Valley Women's Correctional Facility. Again, if you recall, I mentioned that these percentages are calculated using census tract data. There are a lot of people in that census tract with no income. However, ironically, the incarcerated population is very food secure. All of their meals are provided to them. So we need to set that one aside. It's a little bit of an outlier that doesn't quite fit into how the analysis works. So I want to point out the remaining 12 census tracts with the highest rates of food insecurity in Washtenaw County. The one with the highest rate of food insecurity is the Park Ridge area, Perry Elementary or Early Learning area in Ypsilanti. That has an estimated food insecurity rate of 40%. Of people living in that census tract are experiencing food insecurity. There are 5 census tracts in the University of Michigan campus or adjacent areas that have high rates of food security, as well as 3 for Eastern's campus or adjacent, just east of it and north of it. The remaining top 12 are 3 census tracts in Ypsi, the Adams Street area, the Holmes Elementary School census tract area, and West Willow. I want to remind people that we work with a network of 170 partner programs throughout the county. You can see, even though this is a different map, the spacing is equivalent. We work with partners throughout the Ann Arbor and Ypsi area, as well as Whitmore Lake, Dexter, Chelsea, Manchester, Saline, Milan. We really want to make sure that there is a partner program that is near all of our community members, whether they're in the urban or rural areas, and are so appreciative of them and their partnership with us. So with that, I'm going to end. We're not going to do a live Q&A right now, but always welcome questions. You can reach out to CFP at Food Gatherers or me, Markell. My email is in many of the registration emails you've been getting. And with that, let's see here. I am going to end my screen share. Okay, there we go. And so next up, we have a video. Director Robert Gordon of the Michigan Department of Health and Human Services is not able to be with us live, but he has recorded a video. And so I believe Helen hopefully can get that going. So he's up next.
Everyone, it's a pleasure to be with you. I so appreciated coming to visit with you a year ago at State of the Plate. Of course, we're in a very different and more challenging time. Your work is even more important now than ever. I am full of admiration for what Food Gatherers does to deliver support in partnership with organizations across Washtenaw County. Your staff, your board, your partners, all of you do incredibly powerful work to deliver stability and hope to families facing desperate need. These 10 months have taken an unbelievable toll on all of us, but disproportionately those with greater need and disproportionately those in communities of color. The pandemic has laid bare the challenges in our public health system and systemic inequities that existed long before COVID-19, including inequities in access to food. Food is one of our most basic needs, and for families, food banks and pantries have continued to be an absolute lifeline, as well as a partner to the department during the pandemic. I'm going to just talk briefly about our work at MDHHS to make it easier for individuals to access food during the COVID-19 pandemic. I may have talked to you a year ago about our motto. It's the word hope Each letter stands for something. The H stands for human dignity, the O for opportunity, the P for perseverance, and the E for ease. And I think honoring human dignity, honoring the dignity of every individual in our community as a state, and enabling them to get benefits as easily as possible and to get food as easily as possible. These are the core elements of our approach. So at a time when the world became difficult, challenging, and complex because of COVID and states faced backlogs, we knew that we wanted to find additional ways to deliver benefits, to honor human dignity, to make it as easy as possible for people. We pulled together a work group of people from MDHHS and other departments, looked for ways to deliver benefits flexibly to make sure that we were prioritizing needs rather than checking boxes or requiring paperwork. As a result of that, our state was the first in the nation to distribute the pandemic EBT benefit last April. We were able to see one of the largest increases in access to SNAP with the pandemic. I think that was partly about increased hardship, but it was also about the work that we did to make the program accessible and to reduce barriers during the pandemic. We sought and received approval to make nearly 16,000 low-income college students eligible for SNAP. We worked across MDHHS and with an unemployment insurance agency to make sure that individuals, whatever door they came to, they knew all the benefits they were eligible for. We have enabled individuals to use their benefits to buy groceries, or we are enabling them to use their benefits to buy groceries and supplies online through Walmart and Amazon, and Aldi is coming soon. And we recently announced the Restaurant Meals Program, which gives restaurants a source of support in a difficult time and enables food assistance recipients to purchase hot meals if that is what they want and what's best for them. Difficult as the pandemic has been, and it's impossible to understate that, we are at a moment when we see hope on the horizon with 2 vaccines now being administered and more people getting those vaccines every day. We know that even when the pandemic is behind us, access to food will continue to be a challenge. It will be a challenge for opportunity, for education, and for health. So our work expanding access will continue long after the pandemic ends, but we will build on what we have learned in this time. I'll just talk about a few things we are doing to expand access to benefits broadly. We, in August, rolled out a streamlined renewal process for assistance applications. This is through our work with Sevilla. As a result of that application, it is easier to renew, more people are able to renew, and they take less time doing it. We're actively working to increase the number of families who are, if they're in 1 or 2 of our programs, are fully enrolled in all of those for which they're eligible, whether it's WIC, SNAP, Medicaid, or hopefully all of the above. We're using data and the lens of equity to realign our programs and resources to target more of the upstream systemic factors that drive health outcomes. We continue to work on issues of cultural competency in the work that we do, including the way that we document our work and in the way that we work with our staff. And we've worked closely with Governor Whitmer's Food Security Council. First recommendations earlier this month, and it's a blueprint moving forward, which I know many of you have helped us out with. So incredibly difficult time, but incredibly important work that we are engaged in, and more importantly, that you are engaged in. Our partnership means the world to us. I am enormously grateful for what you do every day. So we'll look forward to brighter times in 2021, but the same strong partnership becoming even more strong in the future. Thanks again for having me.
Okay, I'm up next again here. I'm supposed to be introducing Jaclyn Schneider from Senator Stabenow's office, but I don't think she is with us just yet. If you are, come off mute, but I don't see your name in the participants list. So what we're gonna do here is a little on the fly subbing, pinch hitting here. So Phil, are you still with us? Don't worry, I'm not gonna make you go first. I'm gonna go first here. Jaclyn Schneider is the Deputy Director and Policy Director for the Senate Agriculture Committee under Senator Stabenow's leadership. Oh, and I see Callie Fox is saying that Jaclyn's joining us right now. Okay, great. So I don't have to, I was going to have Phil, you and I kind of tag team here, but that's great. Jaclyn's able to join us. So I'll introduce her, and Phil, you're saved by the bell this time. So Jaclyn Schneider, again, is the Deputy Staff Director and Policy Director for the Senate Agriculture Committee under the leadership of Ranking Member Senator Stabenow. Schneider also leads the committee's work on nutrition policy and has worked extensively on specialty crops, organics, and development of local food systems. Prior to joining the committee, she served as legislative director for Congressman Jim Costa of California, where she managed his legislative team and oversaw his work on the House Agriculture Committee and the 2008 Farm Bill. Schneider also led the congressman's efforts on a host of issues, including healthcare and health reform, food safety, education, immigration, and trade. Prior to joining Rep. Costa's staff, she worked for a trade association and federal government relations. Schneider is a Michigan native and a graduate of James Madison University. So with that introduction, are you here yet? I see Callie. Is she on yet?
I don't see her, but I'm gonna. Can I?
Oh, I see her. She's on. She's in.
Great.
Let's see if she can unmute. Because if not, she has trouble. Jaclyn, are you there?
Yes, I'm here.
Hey, hurrah!
apologize for-
Great time and perfect timing. And I'm so glad Callie's here too. So,
Yeah.
Helen, I don't know if you can spotlight Jaclyn and we can get started. Great.
Hi, folks. I apologize for being a little bit late to the conversation, and I may also have to jump off here in just a few minutes. We are actually in the process of having some conversations about how a new COVID package may work and what we might be looking at. So I will share what I know and have a bit of a conversation here to let you guys know what has happened in a previous package and also what we can look at going forward. But I apologize, I may have to just be a bit brief here this morning. So we were very excited that we were able to move forward on a COVID package at the end of last year that was signed into law that did have some good expansions of some of the nutrition assistance components that we've been working on for a very long time, chiefly being the 15% bump in SNAP benefits. This was a key priority for Senator Stabenow throughout all of the COVID packages. We've been advocating for this bump. And unfortunately, up until this point, we're unable to secure that, but we were able to get the 15% SNAP bump included in this last package that will last through June 30th of this year, and will really make a difference for folks that previously had not been able to get any additional assistance, since things like the emergency allotments for anyone who is at the maximum benefit already, which we know is about 40% of folks on SNAP, did not get any additional assistance thus far in some of the actions that were taking place in SNAP. So we're very excited to be able to have that 6 months of a SNAP bump. The SNAP bump actually is a bit longer than what some of the other provisions on direct assistance, like unemployment compensation and some other provisions, how long they go. Many of those actually end in March. So SNAP, we actually got about double the amount of time as some of those other direct assistance provisions. We were also able to include something to waive the unemployment compensation being included as a part of income. So for folks that were being bumped off by the additional benefits that they were getting as a part of unemployment, that will no longer be the case. So we don't want to make it difficult for people that are on SNAP or in need of SNAP because they're getting the additional assistance from unemployment. So we were able to include that as well. We also included some key provisions related to the pandemic EBT program. Specifically, we've been having some difficulty with how USDA looked at the child care provisions. This was something that was very important to Senator Stabenow, moving the pandemic EBT program into the younger populations, kids that were in daycare and under the age of 6. So we had included something in a previous package to expand the program in that direction, but USDA had run into some technical challenges, and we're going to make the program a bit complicated in terms of application procedures and how children would actually be considered enrolled what they would have to do to prove that. So we were able to make some changes that will hopefully free up additional assistance on a much easier basis for children in daycare settings, as well as address some of the concerns on how you actually have to count and determine whether schools are closed at the school age K through 12 level as well. So now all children under the age of 6 will be deemed enrolled in childcare, so they won't have to prove that they were actually in a childcare facility. They will have access to those benefits. So that was very important. We were also able to include some additional assistance for seniors through the Commodity Supplemental Food Program, as well as the Older Americans Act Meals on Wheels type programs, and some assistance for food banks, some additional resources through the TFAP program. We also included on the ag side of the ledger some additional resources for purchasing of commodities. This was specifically designed to be broader than just the Farmers to Families Food Box program, which we did see USDA roll out a $1.5 billion purchasing program that extended the Farmers to Families Food Box program. Our hope was that they would take into account some of the concerns that were being raised about the delivery and some of the size and scope of boxes and some of the challenges that we'd heard from folks on how that distribution process was working, as well as provide some additional resources for PPE. They did not choose to make some of the adjustments that we were looking for, but we did make sure that that pot was not less than 1.5 billion, and there is some additional resources available. So the new USDA might be able to take some of those things into account as well. And I apologize. I'm going to have to jump off here and switch back into my other call because I'm being requested to come in and talk about some of the nutrition programs specifically. So if you don't mind, I'm going to leave you with Callie a little bit. And I'll just mention that we are working on another COVID package that will hopefully provide some additional assistance in the space. Don't know what direction that's going to go yet. We are looking at every available option, but continuing to make sure that pandemic EBT is available for kids through the summer, and making that SNAP available for a longer period of time. Some of the proposals that you saw in what the president-elect rolled out last night, making sure that we do continue some of those assistance resources, not just through June, but for the remainder of the year, and continue to bolster the access. Those are top of the list, and we're going to continue to fight for those in whatever the next package is. And we are also looking at child nutrition reauthorization, which is very exciting. So we'll be running a lot of those decision-making and planning concurrently, which we would love to engage with all of you on and talk about the ways we can take some of the work that we've done on previous child nutrition packages and move some of those goals forward, but also make some tweaks and take into account what we've seen in the COVID time and what we might need to adjust to try and make sure that we're providing good access for WIC participants, for kids in summer meals and after school programs, and continue to address some of the access issues during the school day as well. So I apologize that I'm being pulled away here, and would certainly love to follow up with you guys at a later time as well. I'm sure we'll have lots of conversations.
Thank you so much for squeezing us in. We appreciate you and all your efforts, and give our best and our appreciation to Senator Stabenow. Thanks, Jacqueline.
Thank you. Bye-bye.
Bye. So Callie, we do have just a few extra minutes. If there's other things you want to add, we'd love that.
Sure. And I apologize, I got on later, so I don't know if this was covered. That because of what happened in Georgia last week, Senator Stabenow will now be chairwoman starting on January 20th for the Agriculture Committee again. So we will be able to work closely with USDA and get a lot more of our programs implemented. So please, I know Markell does a great job. The other food banks do, but please keep that dialogue open, especially as the new programs roll out or the extended programs roll out, because it might be a little bit easier to get some fixes these days, and we're very thankful for that. And one thing that Jacqueline didn't mention is we're actually in a farm bill cycle. It feels like we just finished it, but we will move forward with the farm bill discussion. So if things come up, we keep the dialogue open. members, we'll have some different discussions. We have a new ranking member. Ranking member, and so that kind of flips it a little bit. He's from the South, so the discussions will be a little bit different than we did with Senator Roberts, but they do have a great working relationship, so the dynamics will switch a little bit, but very exciting things happening with the chairwoman.
Awesome. Thanks, Kelly, for that reminder that she's soon to be chair. We're very excited about that. And we're so appreciative of all you do and for your commitment to having a relationship with us and all the people in Washington County. So thank you for adding that in. Appreciate it. So next up on our agenda here, we're going to transition. Congresswoman Debbie Dingell was not able to be with us in person, but she recorded a video. So we're going to play that for you now.
It's Debbie Dingell. And I'm so sorry that I can't be there today with you in person and that we're not all together in person. The last one we did of these, I really liked being with everybody. I learned from everybody in the room and we supported each other. So it's really important that today is happening still. And thank you to food gatherers for giving me a few moments to talk about you and how much you do, and how appreciative and the difference you make every day. Eileen, you are simply extraordinary. You're an inspiration to anyone looking to impact lives in their communities. We are lucky to have you in Washtenaw, in the state of Michigan, and I'm lucky that you're one of my friends. To the staff, the volunteers, the supporters of food gatherers, thank you for what you do. Never has there been a greater time of need than this past year. You are saving lives these last few months. I want you to think about the food insecurity that neighbors that may once have given with you, maybe volunteered, have suddenly found them worlds upside down and that they just need a helping hand. We're just grateful to what you've done. This pandemic and the ensuing economic catastrophe that has followed has left millions struggling to put food on their tables. This existing food insecurity crisis in this country is something we all need to pay attention to. And it's made it painful for too many people. Community organizations like the Food Gatherers have stepped forward, and you won't accept the fact that someone should go hungry in the wealthiest nation on the earth. As a community, we have to ask, why is this happening? How do we address the problems? And how do we make sure that no one, no child, or adult goes to bed hungry? So I really want to keep working with you. We've got to get through the immediate crisis, and we continue to have long-term issues. That's why today is so important. So I just want to say thank you for all that you've done, what you're doing right now, and what you're going to continue to do until we're through this pandemic, and then what we do to meet the challenges of ending hunger, period.
Well, thanks to Congresswoman Dingell, even though she couldn't be here today, I think some of her staff are, so we'll pass on our appreciation to her. With that, I'm going to I think I can pull up this, or Helen's got it. Great. Okay, here's our slide. So we're going to be transitioning now. We wanted to have some engaging and some conversation time together, even though we're doing it by Zoom. I think at this point in the pandemic, most of us are familiar to having conversations over Zoom and wanted to use some of the time today for conversation. So we are pushing everyone into breakout Zoom rooms. In a minute, Helen will push the button to magically disperse folks topics. Each Zoom room is going to have a member from Food Gatherers, or there's a board member and then someone from the Food Bank Council, but a dedicated person who's going to be in charge of taking some notes. We have a Jamboard so we can capture stuff. We have 3 prompts for suggested conversation topics, and there's 45 minutes you're going to have for the discussion. You can spend about 15 minutes on each, but that's a loose kind of suggestion. Spend time on the topics as you need. And the prompts are going to be three prompts. One that's kind of a reflection and planning for the present, a reflection on the past, and then a visioning question about the future. So the first prompt is, how can we reach people who need help now? How can other systems like schools, healthcare help with outreach and referrals? What innovative outreach methods have been successful? How can we address barriers that some groups face? So really focusing on, we know people need food now. How can we help get people the food we know they need? The second prompt is related to a reflection about what has the crisis revealed about how we respond to hunger and how we address food insecurity. What's worked well, acknowledging and calling out things that have been successful, but also identifying things where we've missed the mark or even potentially caused harm. So a reflecting question, looking at this past year, this past 10, 11 months, what have we learned about our community and how we respond to hunger? And then the last prompt is a visioning question. Imagine it's 2030. What changes have we made in response to the pandemic? What opportunities were we able to create based on what we learned from the pandemic? So that's a visioning question. Ending on that, I will clarify, when we say we here, we're really encouraging you to think beyond food gatherers or thinking of our community as a whole. Of course, if you have things specific to food gatherers, those are welcome, but also think beyond food gatherers. Think about our whole community, all of the players in our community, organizations, government, businesses, the elected officials, etc. So what we're going to be doing is pushing you to the Zoom rooms. Again, the note takers have the Jamboards that have these prompts there, so you won't need to memorize them. We'll give you a couple of time reminders as we go, and hope you enjoy the conversation and it sparks you to make connections and take action. And we really appreciate your thoughtful conversation. So with that, Helen will push the magic button and you will disperse.